But when I went back to therapy when I was in college after another shoulder injury, it was the therapy that got me better. I had all these other things going on from a healthcare perspective, but it was the therapy that got me better. I had a great PT. We still actually talk periodically, and we had a lot of conversations about what it takes to become a PT. At that point, I was in college trying to figure out, okay, what's next in life? Where do I go? And it was really the outcome I had as a patient that I think determined my path going forward.
Hey there, and thanks for listening to the Beyond These Clinic Walls podcast. I'm your host, Julia, a PT turned product professional, joined by my delightful partner in crime co-hosts, Emma.
This is my tribe. This is how I think.
And Emily.
That is the best getting into PT story I've ever heard.
Founders of the Clinician Transition. Each episode, we interview former rehab professionals who have leveraged their clinical skills into non-traditional roles. I invite you to come hear the journeys, follow the career paths, and learn about the opportunities beyond these clinic walls. On today's episode of Beyond These Clinic Walls, we interview Craig Thompson. Craig is the CEO of Golden Valley Memorial Healthcare, where he spent over 20 years advancing healthcare management, Medicare and Medicaid operations, and hospital administration. Previously, Craig served as the Chief Operating Officer, Chief Compliance Officer, and Director of Rehabilitation at GVMH. He holds a bachelor's in health sciences and physical therapy from the University of Missouri and a master's in health services management from Central Michigan University. A board-certified fellow with the American College of Healthcare Executives, Craig is active on several healthcare boards, including the Missouri Hospital Association and the American Hospital Association. On today's episode, Craig shares his approach for using SOAP note thinking to tackle challenges, the value of becoming a considerate done person, and how growing horizontally before vertically and seizing every opportunity has helped shape his career. Happy listening.
Thank you, Craig. I really appreciate you being on the Beyond These Clinic Walls podcast. Thank you so much for being here.
Yeah, I'm excited. I appreciate the opportunity.
Do you think you can tell us, this is the first question I ask all of our guests, is the high level, tell me about yourself. Very briefly, who is Craig and what do you want our listeners to know about you?
Yep. So that part's easy. I'm waiting for the hard questions. I'm Craig Thompson. I'm the Chief Executive Officer at Golden Valley Memorial Healthcare, which is located in Clinton, Missouri. And if you're familiar at all with Missouri geography, it's exactly halfway between Kansas City, Missouri and Springfield, Missouri. We are a rural healthcare system. We are comprised of a hospital. We have 4 clinics, multi-specialty clinics, some freestanding therapy services facilities, which is important to this crowd. And then also home health, hospice services. We also own and operate the ambulance service for part of that region. We cover a huge geographic area, but it's somewhat sparsely populated. Total lives that we care for, around 80,000 total lives. We have around 1,000 total staff and then employ right around 75 providers, somewhere in that range. Primary care is kind of the heart of who we are from a provider employment standpoint, family practice, and then a number of select specialties that really help to support those services and that care. I'm a clinician by trade and by training, so I'm a PT, which makes sense as to why I'm having a conversation with you all. Emily and I were having a conversation as we queued things up here, and I shared some of the things that I miss about that direct patient interaction. And what I do today, I don't have that immediate gratification by seeing someone take a step or lift their arm up that they couldn't lift up before. So I have to take some solace in those things are happening all around me every single day. And, I'm extremely proud of the care we provide at our organization. We've been a 5-star facility through CMS's rankings. We have an A grade from the Leapfrog Group, which are great things to achieve, but it really just validates the great care our staff provide every day and their commitment to quality and safety. And they work hard to make sure our patients who come into our facilities go out of our facilities better every single day. It's just an awesome thing to be a part of.
Yeah, it sounds like you guys are really running an awesome ship over there. I'm curious if we can rewind back to the beginning of when you were first in PT and pursuing a PT degree. What encouraged you to go into PT? And then maybe what was the inspiration for looking beyond the clinic and taking that next step? I know you have a master's in health administration. Tell us a little bit more about that transition from clinic to beyond.
Really, my first exposure to physical therapy occurred when I was in high school. I wrestled and I had a shoulder injury. That led to some extended time in PT. And I don't know that I was hooked at that point. I was intrigued, but not hooked. After high school, I attended the University of Missouri, and I was a biochemistry major. And there's only a couple of things to do with a biochemistry major. And I thought maybe one of those tracks would be medical school, but I was a little bit undecided. Like all things, maybe college boy, I met a girl along the way who was pursuing a degree as an occupational therapist. And at the same time, or relatively within that same window of time, I had another shoulder injury and had to do some more physical therapy. And that's probably when I became hooked. I had to try to figure out what I want to do when I grow up. I was involved as a patient in a service that provided some opportunity. I had a friend, an acquaintance who was pursuing a therapy degree as well. So I think all those things steered me in that direction. At that time, the opportunity was limitless. And there were 10 jobs for every PT. So the demand was just off the charts, which was encouraging as well. It was also very competitive. I think the year I applied for PT school, I think there were 400 applicants for like 45 slots. So it was ultra competitive.
Wow.
I'm old enough, and that was long enough ago, that a PT degree at that time was a bachelor's. Mm-hmm. It was an extended program. You could do it in as little as 5 years. But I knew along the way that I wanted to pursue leadership opportunities. I had a mentor who was a hospital CEO. At the time, I never would have thought about where I've ended up today. But he said, you might want to think about really expanding your horizons a little bit and think about maybe being a director of rehab services. And one of the things that would help position you in that regard would be a master's degree in business or in healthcare administration. So when I got out of PT school, I immediately transitioned to graduate school at Central Michigan University. And that's where I got my degree in healthcare administration.
I feel like you just touched on so many good parts right there. I think my first question that I had for you is, you said you got like your first taste of PT in high school and then you were hooked after that shoulder injury. Was there like an aha moment or something that like really drew you in, that you're like, this is the change that I needed to go in this direction?
Yep. So my first exposure to physical therapy was in high school when I was recovering from an injury. And then I re-aggravated that same shoulder in college and had to go back to therapy. So in high school, I don't know that I was hooked. I probably wasn't, tuned in enough as a high school boy. I wasn't tuned in much of anything.
Sure.
Certainly wasn't thinking about my future at that point. But when I went back to therapy when I was in college after another shoulder injury, it was the therapy that got me better. I had all these other things going on from a healthcare perspective, but it was the therapy that got me better. I had a great PT. We still actually talk periodically, and we had a lot of conversations about what it takes to become a PT. At that point, I was in college trying to figure out, okay, what's next in life? Where do I go? And it was really the outcome I had as a patient that I think determined my path going forward.
Yeah. You touched a little bit on like what you miss about having that kind of like immediate feeling of helping the patient lift their arm or take their first steps. I think something that I always kind of took for granted, and I think it might have been Kelly from Prediction Health who had mentioned this too. She was like, for you, you see 8 to 10 patients a day. That's nothing. That's just your day. For that patient, that might be their only experience with you, and they're only for PT. In this instance, it's encouraging you to, go into the profession and have this outcome. For other patients, it might be as significant of them taking their first step. And I do miss that too, that impact that you can have. And it's something you take for granted until you're away from it.
Yeah. I think the other thing that, I took for granted at the time, I don't any longer. And it's the relationships you form with those patients.
Oh, yeah.
And I'll share a story. Very early on in my PT career, I was able to care for an individual whose name is Eli Smith. And he had a total knee replacement when I first met him. Like the neatest guy I've ever met. He was a veteran of 3 separate conflicts: World War II, the Korean War, and Vietnam. He was in the Special Forces and served as a paratrooper. And along the way, as a part of his military career, he actually served as the personal protector for the King of Jordan. So the guy was like super highly decorated. Wow. You wouldn't know it to meet him. So humble, just a wonderful individual with just amazing stories. Had this big toothy smile, and every time I saw him, he would smile big and he would greet me. So I saw him as a patient. I saw him in the community afterwards. and just formed this, wonderful relationship. And really one of the probably greatest compliments I've ever had in my life is I was asked to speak at his funeral. And so, what do you say about someone, and what makes you worthy to talk about someone who is that decorated and that committed and has done all those amazing things? But it was that relationship that I formed with him as a patient, and then, literally, in his case, had a lifelong relationship with him, and his family thought so much of me. They asked me to come speak at his funeral. You can't replace that piece, and I do miss that.
Yeah. Oh, that's such a beautiful story.
And of like all the people in his life, like this highly, highly decorated person, his physical therapist was the one to come and speak. That is so cool. Like that just speaks to our, our relationship, like you were saying. That's amazing.
Yeah, I feel like that speaks to you a lot as a physical therapist too, Craig. So that's really cool. In that first intro to you, you gave us so much good detail. I also love that you touched on the importance of mentorship and having a good mentor. It resonated with me because the fact that you had this mentor that was in a position that maybe you didn't know that you would end up there one day, but it was that visibility to say like, oh, I could do that, and have someone that believed in you to say, hey, broaden your horizons, take that step, push you in the right direction. So impactful. Also the reason for this podcast, to have visibility to say, hey, like when I grow up, I can be Craig. Look at me go. I can, have that impact. Tell me more about that mentorship, and like, had that mentor not been in your life, do you think you would have pursued the path you did?
To your second question about if I would have followed the same path, I don't know. I suspect the answer is probably no, because without that direction or suggestion, I'm not sure I would have pursued my master's in administration. I've been blessed, truly blessed, to have a number of mentors throughout my career who have invested in me, which I've taken to heart, and it's important for me to do that now for others. And I'm not sure I felt up until maybe 5 to 6 years ago even that I was in a position to actually serve as someone's mentor. In retrospect, I probably could have provided some insight along the way to some folks. But I've had mentors along the way who've really helped, I think, provide me perspective on things that I should maybe be aware of and I should consider. And I would encourage anyone to be a mentor. And it doesn't take much time or effort, but there's real value. And there's probably as much value, to be honest, as to the mentor as there is to the mentee. But if you're looking for a mentor, I will suggest this very vital aspect to choosing a mentor. One, I don't know that you know who your mentor is until after the fact.
Oh.
Because you have to have some experience and you have to realize something from that relationship to say, that was a mentor. And two, they are not a mentor unless they are honest with you. And if they're only telling you things you want to hear, you're probably not hearing the things you need to hear. And so having a mentor who is very honest with you and helps you understand not only your possibilities, but also the things that might be holding you back is vitally important.
Yeah, that was actually another point that you had in that first chunk of getting a lot of honest feedback that kind of tickled my curiosity. Can you tell us more about that? Like, was there an instance that you're like, oh, I needed to hear this, or maybe I didn't want to hear it, but now I can grow from it?
Yeah, there have been a number of those things. And I'm not sure we can say all those even recorded, but I think there was and I don't know that I recognized it. I think that maybe as a result of being a PT and as a result of going through a process to become a PT that was ultra competitive, when you look around that room at your classmates, you realize there's a lot of smart people in this room. And I don't want to disparage the profession in any way here, so don't take this the wrong way. But to some extent, PTs are often smarter than they need to be, really. When you think about, there is a lot of knowledge PTs have.
Yeah.
And so I was pretty cocky about that. I know stuff. And maybe unbeknownst to me, that showed through at times. And I had a mentor along the way that said, look, you need to understand that you're not always the expert in the room, that other people likely know more than you do, and you'd be better served to listen more. And that's probably been one of the best pieces of advice I've ever had, is that there's more value in listening than responding, because when I just listen to someone And even if they're waiting for me to respond, and there's times it's appropriate to respond, which I do, and my wife hates this about me. I often don't, because one, I want in my professional role to encourage people to solve their own problems, but I need to know how you think. And if I think for you, you're not really thinking. Share whatever it is, whatever concern you have, whatever challenge it is. I'm going to listen, then I'm going to wait to hear how you would solve it and what you would do with it. Doesn't always work in our marriage because my wife wants me to respond at times. And I'm a thinker, so I like to think things through before I talk. So we work through that and we're in good shape. But times when it works great and times that I probably need to do a better job responding quicker.
This is great too for future marriage advice for me, because I feel like that is like one of the hallmark fights of couples.
Your fiance will never know the right answer there because husbands never do.
They just have to go, "You're right, babe," and give a hug.
Feelings are valid. Give me a hug.
Validation. Exactly. Exactly. What other advice have you brought from rehab into your CEO tool belt?
I didn't realize until I started to connect some dots and think about, as it occurs every day in my professional role, I approach most problems and opportunities with a SOAP note format.
I love that.
It's really how, as I reflected on that, it's really how I make most decisions and how I effectively try to lead. It's through a SOAP note format.
Tell me more, because this is also what I say all the time, especially, so I'm now in a product management role. And I remember when I first got into it, I was faced with my first problem that I had to solve. And I kind of went into this moment of panic. And then I was like, hold on, Julia, we've been here before. We know how to get, the subjective and objective. We know how to make a hypothesis and test it and iterate on it. We do this all the time. Let's rewind. So tell me more about your experience with how you approach it through a SOAP note.
I mean, you kind of just walked down that path for me. So but when you think about, when you have decisions to make, and especially when those decisions are far reaching, you want to make sure you have as much information as possible to make that decision. I mean, there's always that whole principle of bounded rationality. You never have enough information to make a perfect decision, but you've got to make a good decision and you've got to make the best decision possible. And then you can always improve upon it later. Approaching it in that same SOAP format where there's always subjective information, and then you really need the objective data to determine how's it really going to work. And then you reassess or you assess along the way and then formulate your plan to move forward. So it is a stepwise decision-making process that works, and it works well.
Yeah.
This may be in the next questions, but I am more in a leadership position. So I am just very interested in, as you became more going up the rungs of leadership, what things rubbed? What challenges did you have as you went from individual contributor, you're doing the doing, you're in the front lines, you're seeing all that instant gratification, but now you're managing people who do that, and then you're managing the managers and all those things.
I probably need to share a couple other aspects of my story because it's maybe a little bit unique in the fact that I spent my entire professional career with one organization. So I started with this organization 28 years ago as a physical therapist. And then after really just a couple of years, moved into a role of director of rehab services, and then moved into a role of an assistant administrator, moved into the role of chief compliance officer for the organization, chief operating officer, prior to my current role, which I've been in now as CEO for about the past 8 years. I've been fortunate that I've had opportunity present itself along the way to grow and expand and increase my authority within the organization. And I think one of the things that benefited me, and I would encourage others to think about, is to volunteer for every opportunity that you can. If you want to grow, you can't grow in a silo and you can't grow vertically. You really do grow horizontally and then vertically. So I remember very early on, I volunteered to be on an infection control committee. I didn't know anything about infection control other than you wipe the stuff down in the gym when people put by line nails. But I learned a lot, and I wanted to understand those things better. I sought out ways to learn more and become more involved within the organization, and really in ways that were maybe outside of my kind of day-to-day activity. Someone's probably not sitting back and waiting to ask you to do something, but you need to ask, because by exposing yourself to new things, you kind of open your mind to new horizons. Plus, you also gain exposure. This way people see you and understand the value you bring to a team and to a service line, and that provides an additional opportunity for people to recognize this is an individual we might want to invest in and grow and provide more opportunity within the organization. Because I talked about, I attended grad school to my healthcare administration graduate degree. What I didn't expect at the time, which is long enough ago that there weren't online programs, so I actually had to do that the old-fashioned way. The rigor of graduate school was less. It was easier, honestly, than PT school. And obviously more diverse, because when you're in PT school, you got these subjects that are all kind of tied together, focused on one thing. That's making you the best PT you can be. But never really mastered anything, even though it's a master's degree, until it came to my thesis. My thesis at the time was, I think it was titled Adopting the Malcolm Baldrige National Quality Award Criteria as a Management Structure. And that's really where I began. As I mentioned, I volunteered for a quality committee within the hospital. Because and you think about it, quality transcends all different areas in healthcare, and really maybe all industries, to be honest. So then I started to research more what drives quality, what types of things are consistent when you look at quality across different industries. And that's where I learned about the Malcolm Baldrige National Quality Award criteria, which Missouri, up until a couple of years ago, had a Missouri Quality Award, which was based on the Malcolm Baldrige National Quality Award criteria. It's probably one of the most respected state-run quality award programs in the country. So as a part of my thesis, I actually wrote a Missouri Quality Award application for our organization that we then submitted. We didn't win, but we submitted it. But lo and behold, 5 years later, we won for the first time.
Wow.
And then became a 2-time winner 3 years after that. And we still utilize those different quality principles to drive the care that our patients receive every single day. And so I think that opportunity to have an exposure to quality and then really take time through a thesis to wrap my arms around it is vitally important, even what I do today.
Yeah, absolutely. And I feel like the quality is like the connective tissue.
I have a question. For the volunteering, are you seeking out things to volunteer, or are people coming to the rehab department and saying, anybody want to do the quality committee?
There was some of both. And I think even when you look at the structure in our organization now, and we're very diverse. We still, at times look for volunteers throughout the organization who want to become involved with something. Other times we kind of hand select. We recognize that, hey, this individual has some attributes or traits that we think will be beneficial to whatever process it is. I think in my case, there were a lot of times that, I heard about something, or I knew there was a committee or a project, and I simply said, hey, if you need somebody else, let me know. I'll be happy to do it.
The initiative. You took the initiative to seek out those things.
More often than not. Yep.
Yeah. That was my questions from before too, because that is such a common theme that we hear on this, is the ability to look for and find ways that you can expand your reach in your current role, but looking beyond it. Yeah, just wanted to echo the importance of that, because I think that's great for opportunities. But then the other thing that had me thinking was, you said you got this visibility. People started to see your face and see where you're reaching out and saying this is an individual worth investing in. But it's also great of building relationships, and building relationships like cross departments, cross sectors, cross verticals. And I think that is so huge. If there's anything I've learned from my career transition, is like the relationship building, the networking, just learning from other people. It's huge. Follow-up question on the volunteering. Was there anything that you did to like self-advocate for yourself, or share your experience and be able to like step in those roles? How did you do that? Because maybe some people have a little bit of a challenge getting the ball rolling to get into those opportunities.
I think I was always very clear with my one-up, wherever I was throughout my career, on my desire to grow. Made sure that individual knew it was important to me. I think I was always very, very clear about my desire to want to learn. And at the same time, I think I was always very clear with my one-up on what I aspired to do next, which is kind of a funny thing when you think about, at times what I would be telling my one-up is, I'd like to have your job at some point. Not that I'm trying to push you out the door.
Right.
You're doing what I'd like to do. And so help me understand what you do and help me grow and gain the knowledge and the understanding to help position myself so that the day that you're not doing it, I'm a natural choice for those things.
Yeah. How was that received by your one-ups?
It was always received very well. And again, I was fortunate to have opportunity for really most of the roles I've had within the organization. I was working with someone who was willing to invest in me and provide me the feedback I needed to continue to grow. And along the way, I was working with individuals who were, a little bit more senior in their career. For many of the positions I was fortunate enough to be promoted into was because someone was moving out in almost all those cases into retirement.
Being in a rehab science, you become a specialist in there, and through schooling, I feel like you have a very siloed vision of healthcare at large. Did getting your MHA open that at all for you? And did you have any aha moments or better understanding of healthcare at large going through that process?
Yes and no. I don't believe that getting my MHA did anything to help broaden my horizons. I was still very focused in rehab, and it was kind of easy because that's what I knew. I do think, though, taking the time to better understand quality did help, because when you think about quality in healthcare, it's really a continuum. It's not any individual transaction in healthcare that leads to quality. You can get a quality x-ray. You can get a quality lab. You can get quality therapy services, PT, OT, speech, all those things. But there's still an individual on the other side receiving that. And so that quality then goes back to the provider's ability to interpret that x-ray, and the provider's ability to interpret that lab work and then take action on it, and the patient's ability to understand the direction to control their diabetes or take their medication appropriately. That's when I started to recognize that, it's not just about this. It's about how the care for that patient transcends all these different aspects of the healthcare continuum.
You were saying that you would tell your one-up that you want to be where they are. One thing that I've recognized in people who are able to move up well and are thought of is they do anything possible to make their one-up's life easier. Anything that they hate doing, they're like, let me do that. Even if it's something really annoying, because it usually is. Did you ever do that kind of stuff for your supervisors and your leaders?
Yep, absolutely. I was a plate cleaner, so I would take whatever I could off their plate.
Yes.
At times they appreciate it, and times I was probably annoying. and I have, there's people that I work with every single day who do the same for me, which I appreciate. And then there's times that I don't appreciate it as much because, I got to do some stuff too. So
I feel that. I feel that too.
My predecessor, who was the CEO of our organization prior to me, he one time called me a consider it done person, which was one of the greatest compliments I've ever received.
That's great.
I love that framing. Like, where are my consider it done people?
Craig, I wanted to ask, you've had these mentors. You've considered yourself a mentor now, which I think you could have way before you said like 5 years ago, I feel like. Tell me about some of the ways you are uplifting rehab professionals at Golden Valley.
I'll get back to this. I'm going to go in a big circle. One of the things you asked is if I could zoom into the past, what would I give my past self? What advice would I give my past self? I think that what I would say in that regard, and something that I work hard at now because I see such value in it, is being able to illustrate to people what needs to be done or why things need to be done with a story as opposed to direction. But stories, man, they help so very much. And reminding people of the value in the things that they do can be relayed better with a story than they can be with a pat on the back. We had this situation in our hospital in which there was an individual who was admitted to our ICU. She was a 96-year-old lady admitted from the local nursing home with pneumonia. And you know what happens when you have pneumonia at 96 years old. The outcome may not be good. And so this lady's niece was called because this was her last living relative. And so she came to the hospital, and she really wanted to be by her aunt's side during this entire hospital stay in the event that the end were to come, because she didn't want her to be alone. So after sitting in our hospital in the ICU with her loved one for 3 or 4 full days, her aunt had actually started to rally a little bit. And this individual decided, this is my opportunity to go home, see my family, get a good night's rest. You can't sleep in a hospital. We wake you up to make sure you're sleeping. We do weird stuff like that. But get a good night's rest, shower, change of clothes, and then come back the next day. And so she talked to her aunt's nurse before she left that evening and said, look, I'm going to go home, do all these things. I'm anxious about leaving because I don't want my aunt to be alone. Something were to happen while I'm gone. But I think this is my window of opportunity. So she left, drove the 3 hours home around 5 o'clock that night. And then later on that night, around 2 a.m, her phone rang. It was the same nurse she'd spoken with earlier. And the nurse shared that, unfortunately, her aunt had just passed away. But the nurse went on to share, I know it was important for her not to be alone. My shift got over last night around 11 o'clock. I didn't have anywhere to go. Your aunt wasn't doing very well. So I sat with her and I held her hand, and I was holding her hand when she passed. And I think that story is much more impactful than for me to walk around and help people understand why we got to be nice to people, why we got to show compassion. Because we can talk about all those things, but if we can relate it to a story and an actual event, which we see every single day. Within our facility, PTs are helping patients walk for the first time. Our speech pathologists are helping a kid say mom or dad for the very first time. Our OTs are helping people write their name for the very first time. Those are miracles to those patients. And we have to harvest those stories and remind ourselves every single day why we do what we do. We do hard work, but those stories just connect all those dots and bring us back to what we do. So I think to answer your question, Jules, the most important thing I think I try to bring to our organization is the ability to connect back to why we're here and what we're doing, and to share those stories and not look past those simple things to us that are miracles to somebody else every day.
That was beautiful too. Taking this to the next level and tying it back to rehab professionals. We are great communicators. We are great storytellers. I recently heard, do you know Think Fast, Talk Slow?
No, but I should know Think Slow, Talk Even Slower. So
yeah, there's the author of that really hones in on the idea of telling a story and just the impact that it drives with it. Like, no one is responsive to lists or, demands. It's human nature to evolve and relate to stories. But yeah, I love that impact that you're driving, and I love that you're using that communication and storytelling to do it. On the flip side of that, so you gave yourself advice for past Craig. If you could go to the future, what would you ask future Craig for advice?
So I think the thing that I would want to know from my future self, and this is a priority for me that I sometimes achieve and I sometimes fail. I want to know that I have achieved the right balance in life. My job's important. I mean, I love what I do, and I'm so fortunate to get to do it every single day. And we've got an amazing team that provides great care. As a matter of fact, my wife and I were talking, I don't know if you all saw that just a couple of days ago, someone in Oregon won the Powerball, like $1.3 billion with a B dollars. And one individual won that. It wasn't me. And my wife, we were talking about that. She said, how do you think our lives would change if we won that Powerball? And I said, well, I think our retirement date would change. And she said, I don't think yours would. She said, I think you would keep working. She said, it's just part of who you are and what you do. But I think that, back to that, did I find the right balance? I'll never forget, I heard an interview with a lady who had 8 children. And the person interviewing her asked her, do you love any of your kids more than the other? Or do you love them all the same? And she said, and it's profound, she said, I love the one the most who needs it the most at the time.
Oh.
And she went on to talk about, when this child's having this problem or that child's having that problem, that's who I love the most because they need it the most at that time. And that's how I try to live my life now. I have, obviously some work demands that require some time. It's 7:47 p.m. now when we're talking here in Missouri. But my wife said a school event Kids are doing stuff. They're not missing me right now, so it works out perfect.
Yeah.
But there are other times they need me. And I try to prioritize that and make sure I find that right balance. I think if I were to ask my future self something, it would be, did you find that right balance along the way?
There's so many times you've talked where I get chills. I can tell that you're very good at stories.
Yeah, I'm like, tell another story, Craig.
Tell another one.
Well, I will share this. It's not a story, but if I was going to suggest to anyone some things that they can do to grow and to further themselves and better themselves, one is public speaking. And taking advantage of any opportunity anyone ever provides you to speak in public, whether that be to the Women's Methodist Club, where there's 5 old ladies sitting around eating pineapple upside down cake, or that's a room full of people. If you're ever asked to speak in public, do it. It is such a builder in terms of your ability to communicate. It requires you to understand things. If you're going to talk about them, you better become at least a minor subject expert.
Are there any topics that we didn't touch on that you'd like to take this time to talk about, or any questions that you get asked really frequently that you want to use this platform to address?
I'll share a story with you real quick. One more. I think one of the things that we've done from a healthcare perspective, and so I'll say I did because I won't cast this on anyone else, is focusing on the reason the patient's there, so their problem. So someone comes in with back pain or with knee pain, and that's what I focused on. How do I lessen your back pain? How do I treat your knee pain? How do I fix that gait abnormality? I think one of the things we've done, maybe institutionally across healthcare, is start to think about what are the greater causes, as opposed to I stepped in a hole and sprained my ankle. What caused the hole? And I think we're doing a better job of that now. And I'll share a story about our organization. We are now making sure we are learning about our patients' social needs, whether that be housing insecurity, maybe they feel unsafe in their home setting, whether it's food insecurity. We had a patient, a young lady, with what looked to be probably a 3-year-old child, and we asked about food. Do you have food at home? And the mom said, yep. And the 3-year-old kid said, Mom, I'm hungry. Probably said it a lot sweeter than I just did. And thank goodness our staff member didn't just let that pass. They asked them more questions. What's that mean? And the mom went on to share that she has 3 kids, 3-year-old, I think it was a 7-year-old and a 10-year-old. And the 7 and 10-year-old are in school, so they get breakfast and lunch every single day. She struggles to feed them dinner. She struggles to feed the 3-year-old every day. In credit to our staff, they picked up on that, and they connected her with resources that she was able to utilize to make sure that food insecurity would be addressed. But they went beyond that. They pulled together some of their coworkers, and while that individual was seeing her primary care physician, they ran to Walmart, bought a bunch of groceries, diapers, wipes, brought them back, and as soon as she walked out of the exam room, they presented all that stuff to her, which is just so awesome. We wouldn't ask that of our staff, and we wouldn't expect it. If they didn't do that, they still did all the right things because they connected her with resources that benefit her beyond that one trip to Walmart and one trip to the grocery store. But man, that's so awesome to think that we're now thinking about the things that cause the problems I know when I was treating patients as a PT, I was guilty of, I'm focused on this one thing, which maybe never really fixed the problem. They were better for a while, probably, maybe better in the long run, but they weren't fixed. I think we're doing a better job of thinking about how we can fix things.
Yeah. You can't just treat the elbow. You have to treat the body it's attached to. And I think at a bigger layer, healthcare is trying to do that now, of being able to treat larger systemic, which is just being a great part of the community. And I like where that evolution is going. It's so nice to see a tangible example of that.
Yeah. And how great that you're now in a position where you can have that impact and understanding of it's not just fixing the sciatica or making the perfect manipulation, but the bigger things that can impact someone's sensitivity to pain or whatever the case may be, or food, resources.
It's time for the show and tell. Woohoo!
All right, let's move into the show and tell. Craig, do you think you can share with us what you brought to share with our audience?
Yep, absolutely. So, one of the things that I think we have as a profession, as a PT profession, been slow to do and have not done very well, at least in the state of Missouri, which I'm most familiar with, is being involved in advocacy and work to inform policy. Missouri, just this past year, allowed for direct access to physical therapists. Really, as PTs, we're to blame for that because we didn't take the time to inform policymakers. We didn't take the time to advocate for our profession. So there's opportunity, I think, no matter where you're listening from, to better understand how to advocate, to better understand how to inform policy, both at the state and national level. At the state level, it's really pretty easy. If you go see your elected legislator in your state, I promise you they'll give you time. And if you shoot them an email, I suspect they will respond to your email. If you call their office and want to talk, you'll get a call back. That's a little bit harder on the federal level, but at the state level, I am confident they will respond. And they want to form those relationships. I think the thing that we have failed to do at times is advocate for our profession and help people understand how important our profession is and all the good that our profession brings to people and the benefit that can be derived from it. And you think about all the debate across the country around the cost of healthcare. Therapy services is an opportunity for us to reduce that cost of healthcare. PTs, as I mentioned earlier on, we know a lot of stuff, probably more than we really need to know, but we know a lot of stuff. We can be educators. We can help our patients control their diabetes. We can help our patients obviously recover from an injury. Those things we know, but there's other things that we can do and we need to do. But part of that's informing policy. And if we don't take it upon ourselves to inform policy, no one's going to do it for us.
I hear more opportunities to be able to self-advocate, but also to reach out to network, to stand up for our profession, and to educate. So I love it. I'm a fan of all of this. For our listeners too, please check out Dana Strauss's episode. She went into a very large show and tell on health policy and would be a wonderful complement to this episode. So as soon as we wrap up here, just go put on that episode. It'll be great. Craig, thank you so much for being on here tonight. I appreciate your patience with all of our technical difficulties. I really value your time, so thank you for giving it to us tonight. You've done so much for us and given us all this information and background. Is there anything that we on this podcast or our listeners can do to support you?
You've done it. You provided me a platform, which I appreciate. And, I admire both of you for taking the time to continue to promote the profession and for all you're doing to raise awareness and your desire to, try to open people's eyes to different opportunities. It's great. I admire you both.
Thanks to everyone for listening to this episode of the Beyond These Clinic Walls podcast. As always, be sure to follow us on LinkedIn and Instagram at Beyond These Clinic Walls for all the latest updates and episode releases. Make sure to join the Clinician Transition group on LinkedIn and Slack to be part of the networking community for like-minded rehab professionals. Questions, comments, concerns, or do you know someone who might make an excellent guest on our next show? Reach out to us at beyondtheseclinicwalls@gmail.com. And as always, thanks so much for listening.